Okay, welcome officially to our second Trisomy Talks. Thank you for your patience, everyone. We had a few technical glitches getting everybody on, but I'm so excited to see a good number of participants. And we are recording this, so if you have to bow out or if there are folks that weren't able to make it live, we'll definitely get this posted somewhere. Sorry for the bad lighting on my end here, but I am not the featured speaker. We are here to hear from 4 amazing parent panelists, and I'm super excited for these ladies that have stepped up to share.
I'm giving you a face shot.
And then, so they're going to spend about 5 to 7 minutes introducing themselves and their child and sharing about their journey, specifically with feeding tubes. I know there's a lot we could talk about, but we're going to stay on point with the feeding tubes. And then we'll open it up for questions. And I did have one question submitted beforehand. So if she is not able to be here, I'll make sure that that gets asked. If you think of questions while the panelists are sharing their introductory stories, go ahead and put that in the chat, and we'll make sure that we hit those questions as well. Okay? All right, without further ado, I would like to introduce my friend Amelia, who's, well, I'll just let her introduce herself. So Amelia, take it away.
Hi guys, I'm Amelia Platty. I am mom to Olive and her 5 siblings. Olive is 3.5. She has mosaic trisomy 18, and she has had a feeding tube since birth. We started out with an oral gastro tube. You see that a lot in the NICU before they place an NG. Ours just stayed permanently because of lots of issues with her nose. Her ENT told me he would kill me if I gave her an NG. So I had a doctor's orders. She stayed in the NICU until she was 4 weeks old, and they sent me home with an OG tube and taught me how to place it. I didn't realize that that was unusual. I didn't realize that that wasn't a thing. My nurse told me later I was the first parent sent home like that from our NICU. We worried about feeding. She did take a bottle about 30% of the time when we went home, and she did nurse for a brief time. So that was a huge deal. She ended up having major nose issues when she was about 2 months old, and then contracted RSV, and she basically couldn't breathe and lost the desire to take anything orally. And by the time we got all of that sorted out, she really just didn't want to try. I fought it a long time. So my biggest thing right now is to be a support for someone who is feeling like that's a failure or it's a bad decision. I know I got real defensive when people were telling me that it would not be a big deal to get a G-tube, but we fought it. We did feeding therapy for over a year. And then we finally we had to make the call. She failed swallow studies over and over. We were concerned about her aspirating, and we just wanted her here with us. So we made the call when she was 16 months old, and we placed a G-tube. And right around the time she really got good at OT skills and could pull out her tube all the time. So that was my deciding factor. She wasn't getting it because I was constantly putting it in. So for us, it's oral aversion. We are still attempting oral feeds. We have feeding therapy once a week. We actually have a swallow study tomorrow to, I think, make the final call if we're going to continue any kind of thin liquid. At this point, she will take purees for taste, and we do it just to keep her used to things. So that's our short version of our story. We also have a child with Down syndrome in our family, and she nursed and took a bottle fine, but she has very particular oral aversions and texture issues. So with Olive, it was couldn't swallow, couldn't breathe, lots of reflux issues. She really just didn't want anything in her mouth and down her throat. So that's my story.
Thank you, Amelia. We'll go ahead and go to Tiffany, if you're ready, Tiffany.
Okay. Can you guys hear me? All right. Sorry, she's tired. She's doing her thing. So this is Ayana. She's 20 months old. She is full trisomy 18, but she is also mosaic in 60% of her cells. She is both. We don't know how that's possible, but we've had it checked several times. In terms of feeding, Ayana's pretty much had every single tube. When she was first born, we started out a hospital down in South Texas. We originally wanted to have her born up in San Antonio, Texas, but it wasn't possible. So we were at a hospital that had no experience with living trisomy 18. And we were only there for 3 days, but it was a battle. So when she came out, they wanted to bottle feed her, and very, very large amounts. I went along with it for a little bit. Honey, no more banging. But I saw very quickly that it wasn't going to work. It was just too much. So I actually requested and had to actually really force it for her to get an NG tube. And that was the beginning of her tube feeding. We did do some syringe stuff for a little bit. And then when she got transferred to the NICU in San Antonio, she still had an NG tube, but we still were doing 1 bottle feed a day. She had passed a swallow study, but with her heart defect, she had a very, very large VSD. Hold on. She had a very large VSD with some other issues as well. And for her, feeding was a marathon. She would be out of breath and sweating, and then she would sleep the rest of the day. It was so hard for her. So I finally made the call probably about 3 weeks old. We were still at the NICU for a month and a half. I made the call to just mix all oral feeds, even though she could do it, simply because I felt like it was a self-defeating cycle. We were working so hard to gain all this weight for her because she was so tiny, and then she would burn it all just trying to eat by bottle or by mouth or syringe or whatever it was that we were doing. So we nixed all of that and just went 100% NG tube. She was discharged home on NG tube until I could find care for her because they refused her heart surgery. And so I placed all the NGs at home, and we did not have nursing or anything like that. So I was just watching like YouTube videos and sweating and like so nervous about it. Oh man, it really got me in those early days. And I was working with a GI doctor here down in South Texas, and they had never even talked to me about other tubes besides a G tube. So I didn't even know other things existed. So when we got up to Austin, Dell Children's in Austin, she had been having some very, very, very severe issues around feeding, and painful episodes all night long, crying, stooling issues, gas issues, the whole deal. And so it came down for me to the point where I felt like there was something wrong with her stomach. And we couldn't figure it out, but it was always associated with feeding, and it was associated with the tube, it being pushed, or using the pump. Because we tried bolus feeding, we tried continuous feeds, I did syringe feeds, and this was all breast milk, but we did try fortification, we tried formula, and eventually what we settled on was switching to an NG tube. I'm sorry, an NJ tube, nasal jejunum. So that goes to her intestine and bypasses the stomach. And then we stayed on strictly breast milk only. I got rid of all formula, all fortifiers, everything. And with the NJ tube, the first time she was the most comfortable I've ever seen her. She wasn't crying excessively, but she still had gas issues. So then we added continuous venting of her stomach. And we did that in various ways as well. And she then got a G tube, but kept the NJ tube. And we vented her G tube continuously to just remove all of the excess bile and things that were upsetting her stomach and making feeding so uncomfortable for her, and kept all of her meds and her feeds through NJ. And she stayed on that combo, the NJ plus G tube continuous venting, for up until a month ago, and she's 20 months. So well over a year and a half. She was that way. And we finally got her a GJ tube. So that's what she has now. So this is her venting. We still vent and we still have continuous feeds. So she always has 2 tubes attached, and it's what's comfortable for her. But it took a really, really long time for her to get to a safe weight to get the GJ. The rule for our hospital here is 10 kilos. So she's now 10.1 kilos. So we finally made it to that part, and she was able to get the GJ tube and finally have a tube preface for the first time. But when we feed to the intestine, it still requires you to feed continuously. So we haven't been able to get away from that part. So she's 22 hours on the feeding pump with continuous feeds. And she gets 2 1-hour sessions during the day for like therapy and other stuff, kind of like when I'm prepping stuff in the morning. And we just flush it with water and then clamp it, and it's good. I've never really left it longer than like an hour or 2 at the most. And after breast milk, she did that for up to 10 months. And then we switched over to Kate Farms. She has a cow milk protein intolerance. So this was the only vegan option that we could find for her. But we're looking forward to hopefully starting blended feeds with her GJ now that it's a bigger tube. So I think that's everything. If there's any other questions, just let us know.
Thank you, Tiffany. Pam is gonna go next.
Hi, everyone. So our little one is Aiden, and he's 3.5. He has trisomy 13 mosaicism, and he was diagnosed in utero with full trisomy 13. And at the time when he was diagnosed, we were told that he probably wouldn't live very long. And so we, although we did an initial care plan, we just didn't really think about long-term feeding. But what we wanted was for Aiden to have support and to have a feeding tube placed if necessary. So when he was born, within a very short time, they placed an OG, and about 2 days later, they switched it to an NG. So he was able to be fed, through his nasal passage. He spent 26 days in the NICU, and I was trained on how to replace the NG tube. And I remember the first time that I did it, I was so scared. I just did it. It happened. And then the second time that I replaced it with the nurse there, afterward, I just cried. I was filled with self-doubt. I was like, how can I bring a child home? How am I capable of doing this? And the nurse sat me down and said, you can do this. You have to. And I went home that night because we couldn't stay in the NICU. I went home that night, and that sat with me. And I, in my heart, I realized that I could do it, and I was going to do it. But lo and behold, a couple nights later, Aiden pulled out his NG tube, which he had done before, and the overnight nurse decided to feed him orally. Now, we had been working on oral feeds or bottle feeding almost the entire time that we were in the NICU, but initially he had the NG tube because he wasn't showing much interest in sucking. We attempted nursing a couple times in the NICU. We attempted bottle feeding. We attempted all different kinds of bottles and nipples to try. And we ultimately came to a decision that we wanted Aiden to be able to focus, sort of like practice one method. And so we decided on bottle feeding. So even though he was getting the majority of his nutrition by NG tube, he was still giving the opportunity to practice with bottle feeding during the time that he was in the NICU. But it was really inconsistent what he was taking. So we had every plan and intention of going home with an NG tube, except for that night, that fateful night. And the nurse was able to, he took all of his feeds that night by bottle, and it just continued. It wasn't an easy thing. It was a constant struggle. But at that point forward, we were going home without feeding by tube. So, and we also went home without a swallow study. And Aiden would continue to be orally fed, bottle fed, spoon fed, cup fed. We tried every method over the course of the following 6 months. And we employed some of the best feeding therapists around. And what we realized over time was that he really wasn't handling oral feeding. He was pretty uncoordinated with the suck swallow mechanism, and he was starting to lose ground on the growth chart, like his growth chart. So it wasn't until he was 7 months old that we realized and found out he had a swallow study, and we found out that he was actually aspirating all forms of consistencies of what we were feeding him. So thin liquids, nectar, thick thins, as well as residuals from purees, because we'd started some spoon feeding. And it was at that moment that I defined that was really the beginning of our journey with tube feeding. An NG tube was placed later that day, and we were inpatient for a couple nights to get used to the NG tube, and for both Matt and I to get trained again on NG tube placement. And ultimately, Matt ended up being the one who was far better at doing that. I was a chicken. I really struggled with placement. So I was the one kind of holding Aiden down when we had to replace it, and Matt would put it in. But it was a very difficult thing for us to do, very stressful. And so the plan when we got the NG tube was that we would work on getting nutrition in Aiden and get his weight back to a place where we felt like he was in the right spot, and that he would have a follow-up swallow study to see what he was doing. They really thought that he was just weakened, that he was malnourished and needed more strength, and that he would ultimately, the swallowing would come along with it. But what we found in 3 months was that although he showed some improvement, for the most part, he was still struggling with thin liquids, or he was still aspirating thin liquids. So we knew that tube feeding was going to be a long-term thing for him. And at that point, he hadn't even been really approved for oral feeding. So we were kind of just keeping the oral stuff going, pacifier with every single tube feed, playing with a spoon, letting him, touch, just we were encouraging that as much as humanly possible. But we ultimately decided on the G tube just before Aiden's first birthday, and it was actually placed 12 days before he turned 1. And it was thankfully a pretty seamless process to get the G tube placed. We were home I think we had to stay 2 nights. And when he came home, there was definitely an adjustment to not to seeing his face. Like being able to see his face was actually an adjustment for us. And actually, I brought the picture of him. This is him, his first birthday. We postponed his first year pictures because we knew he was going to get his G tube. So those are taken right after. But I digress a little bit. But after he got the G tube, we found that he really took off. We were able to feed him the stuff that we hoped to feed him. There was a little bit more flexibility compared to the NG tube. We ultimately started feeding him some Nourish and some home blends. And I'm trying to think if there are other things I really wanted to touch on. But we've learned to replace his button at home. I found that you could see a lot of videos of people posting on, Facebook or YouTube about how easy it is to change a button. And for the most part, it is an easy thing to do, and you can do it at home. But for Aiden, his stoma is tight. It's a really beautiful stoma. And we have to lube it up really good in order for it to get it in and out. He does not love getting his G tube replaced, and he cries. So he's not one of those kids that just is there and is kind of like easygoing about it. So it's a little bit of a fight, but we continue to work on oral feeding still, and that is super variable for Aiden. We've had several days this spring where he took 20 ounces of smooth purees by mouth, which is like mind-blowing for him. And then there are days when he just wants to spit it all out. So he's very texture sensitive. We really stick to just smooth purees, but we're very thankful for his G-tube. And I mean, it's just made a world of difference for him and for us. So that's all.
Thank you, Pam. And our fourth panelist is Valerie. So Valerie, if you're ready to introduce, then we'll go to Q&As.
Hey, so my son's name is Angel. Most of you guys know him. He's got full trisomy 13. We knew about it in utero as well. When he was born, he had an omphalocele and was intubated. He did have an OG tube for a while. He had an NG for a while. He had an NJ for a while. He had an NG and an NJ. We kind of went through the motions with a lot of it. We had a lot of respiratory issues, and he ended up being trached. Angel's been trached since he was 7 months old. And he didn't come home until he was almost 8 months old for the first time. So he was in the NICU and the PICU, and he never had a swallow study. He actually just had his first swallow study done in March, and they never let him try. He had a G-tube placed in July of 2017 before he come home for the first time, and he did okay with it. They did not do I can't think of the other procedure. It's where they close it, where they can't reflux. So he did not have that done, but he did have the G-tube. Around his first birthday, he started having a lot of residual. He would have double what he was being fed in residual, a lot of dark green bile. And the decision was made to give him an NJ, and he had a GJ up until January of this year. We slowly worked on transitioning him over to G feeds. We would start giving him just a little bit of what he would get in his stomach and check his residual and make sure he was tolerating it well. The whole time he had the GJ, he did get his medicine through his G-tube, and he got a continuous feed through his J-tube. He was on for 20 hours a day. We gave him two-hour breaks. With those, you have to flush them. The problem we had with it is when those are pulled out, which he's gotten pretty good at pulling them out, you have to go to the hospital and have those placed. You can't just replace those at home. And we had him admitted one time over the weekend because there was nobody there that could place it. And it was just a whole thing. But luckily, when his had to be replaced, I know there's some where they have to put them to sleep to be able to place the GJ. And we didn't have that issue. But he just got to where they would let him start taking things by mouth. He's allowed to have 5 spoons of thin liquids and 5 spoons of purees by mouth. In the swallow study, he did fine with it. Nobody ever let him try. When he was really small, before about 3 months old, he would take a pacifier, and we could put drops of breast milk on it, and he would take it fine. After he was intubated for about 4 months off and on, he wouldn't even take a pacifier. So now he won't take a pacifier. He does, however, like if we try to give him a taste of something, he'll lean into it. He'll smell something and he'll try to go for it. He loves, one of his favorite things is licking the ice cream with his daddy. That's one of his favorite things to do. But it's been a lot of people said that you can't really transition back to a G from a GJ, and we haven't had that issue. He's been tolerating the feeds very well. An issue we have had has been constipation, but he did have a gallbladder issue, and he actually went septic last year in May because of pancreatitis related to his gallbladder. And after we got that removed, a lot of his abdominal discomfort has been remedied, but we were able to transition, and we're not really having any issues with it. He's a lot happier. He doesn't aspirate. He tolerates it all pretty well.
That's fantastic. Wow. There's so much experience here. Panelists, I'm going to go ahead and have you unmute, and that way you can answer as long as there's nothing, super distracting going on in the background. And I saw Jennifer's comment, Pam, when you were talking that Dane's stoma is the same, that they don't change it unless it comes out because it's so traumatizing. And I know that we had a traumatizing one with Verity too, and it just turned out that she had just grown and it needed, the angle of going in was different. And so we actually had the next one placed in the surgery clinic, and then they had our nurse and us feel it so we could feel the difference. And we haven't had any issues since then. And I will just throw this out there. If anyone's interested, we are going to do a live G button change tomorrow on Verity's Voice. So if that's helpful for anybody or anybody that you know, that just to take some of the fear out of it, we're gonna go live and do that. But
that is an awesome resource to have.
Yeah,
because
it's so good to just see people do it.
Exactly. It takes so much of the fear away.
Yeah. I remember watching Evelyn's mom, Hannah, when she used to post the NG too. I remember I watched it when I was pregnant with Ayana, and I was like, oh my gosh.
Yes. If you know Katie Buck, she pulled out, when she did a change, she saved the button and she did a whole video in Alexander's, I can't remember the name of his group, but I've watched that a couple of times. I thought, okay, I can do this. And that was,
I watched that one too.
Just seeing the button and how it worked. And it really, I was so terrified about surgery. Surgery to me was such a huge deal. And, now that it's not, and we haven't had major surgeries like some kiddos have, but yes, anything we can do to take life is helpful. So, girl.
Sorry, that's Ayana.
That's okay. I love hearing her voice.
I was just going to add that it's the last time we changed Aiden's button, we had to do it at home. Well, at least we thought we had to do it at home because of the stay-at-home order. It was just 2 months ago, and he actually did better this time than he has done before. The last few times we've done it in the doctor's office because we were concerned, or I was nervous about doing it at home. And I think that part of the reason why I think there's a combination of reasons why he gets upset. I think one is because he's in the doctor's office and he doesn't like lying down on the exam table. But the other part is that his stoma is so nice that it's not like the most, it's not the easiest thing for him, but it's not the most traumatic thing either. So it's not like we're traumatizing him.
See, Olive laughs. She thinks it's hilarious. So that's good because the first time we went in for surgery checkup after the G-tube, we were all good. Next time you come back, we're going to change it out. And we got to the garage of the hospital, and I caught the extension. So there's number one right there. Take the extension off.
Yeah. I've pulled it out so many times from that stupid extension.
Because I pulled it off, and I turned to the kids that were with me, and I said, we're going back upstairs. And I shoved in. I had brought a spare. I don't know why I knew to at that point. And we went back upstairs to the surgery clinic, and we're like, so we're changing it today. So that nothing could be as scary as that being pulled out in the middle of the Vanderbilt parking garage by myself.
Hey, Beverly, I wanted to add one thing because I just didn't ever know this in our journey, and I wish I had known because I would have made a different decision. But I know historically when people get G-tubes that have kind of like reflex GERD issues, Ayana had severe reflex GERD. So when we got the G-tube, her doctor said, oh, she should get a Nissen with it. Like, that's standard. We do the Nissen G-tube combo. Well, I didn't know any better, so we did it. And I just would caution anyone who's facing that decision, get the G-tube by itself. If they still are having reflex GERD, you move to NJ. If the NJ helps you, then you could either go to like a GJ, or you could add the Nissen if you need to. But what we found for us, and anatomically, I know every kid's different, but for Ayana, that Nissen has caused more issues in terms of retching. She retches, she hiccups for like, some days she'll hiccup the whole day. It's that Nissen is you can't take it back once it's done. So
That's why we didn't. Someone had that same experience that you did. Harper Great, Shonda's daughter. Yep. And she was like, don't do it, don't do it, don't do it, don't do it.
I didn't find out till after the fact. Like, I even posted
I was so
asking
lucky.
everybody. I was like, someone tell me. And everyone's like, oh, it's been great.
That's why they didn't want to do one with Angel either. He had so many respiratory issues, and they just didn't want that to be an added issue. They said, if he has reflux after that, then they can always go back and do it. But
that's what our surgeon said too.
Yeah. So if you're watching this and you're facing reflex GERD issues, do one thing at a time. Don't bundle.
Because it's probably something else, and you can always do it later.
Yeah. And you can always outgrow reflex GERD with therapy, because reflex GERD is commonly, with typical kids, it's because they have low tone. Typical kids outgrow reflex GERD around 6 to 8 months, because they're able to sit up. The gravity is able to keep everything down. So just remember, like, therapy, like, just go one stage at a time is what I wish I'd done just with that one decision. It was a big one for us.
Yeah, we had a lot of issues with reflux and thankfully our GI, they thought of the Nissen as being a last resort. So we're thankful for that, for sure.
I was going to say, most hospitals don't even do Nissens anymore. They go straight to GJs instead. So
that's good.
Yeah, so Jonna had a GJ to start with, and then she went to a G tube. She actually, her GJ busted when they were in the middle of trying to figure out if she should go to a G tube. So they just went to G tube. She had her own plan. And then we just did little by little, and she did great. She does bolus feeds. And she's up to, let's see, she's at 110 6 times a day now.
Good.
And I should say, I don't mean it's like, I shouldn't say traumatizing, but his stoma is so tight, you actually get double pop when it goes in. Like, it probably should be dilated if it doesn't go in again. Oh. So that's why it's so, for him, it's really, I shouldn't say it's painful, but it's not comfortable at all. But there's nothing you would do it for, because the G-tube goes in and out, especially, like, we can only do, I can't put an old one in there. It has to be that nice, stiff new one. And so if we ever had any issue, we would just have to go get dilated. But it's worse to go through the dilation if we don't do actually have it dilated. So, because new ones do go just fine. It's just not fun.
Tiffany, thank you for bringing up the Nissen, because that is such a huge conversation with our kiddos with the feeding tubes. And I know I kind of had a rank of, what I was willing to consider next with Verity's early reflux before she was 1. And Nissen was really low down on my list of things that I wanted to consider. And thankfully, our GI doc was very willing to do minimalist interventions. And I think it's definitely a good thing to explore, to research. Like you said, change one thing at a time, so that you can see what's going to happen.
Isolate variables. That's what I say. I isolate and do very small incremental changes.
And what you said, Tiffany, about knowing what was working and wasn't working, learn to be able to say something's not right. And as much as they feel like you're not in control there,
like when they tell you your reflex is normal.
Right.
And that's not normal.
And it's like, oh, we can try this med and this med and this med and this med.
Yeah.
To be honest, I tell complex care to not bring nutrition in anymore, and that's because I know because they want our kids to grow, and like you said, you have to be a certain weight to get certain surgeries.
Mhm.
But Olive was so blown, like they formula supplemented. I gave her breast milk until 6 months old. It turned out it was actually her problem was with me. We eliminated everything out of my diet. It was actually me. So that's something to consider too. If there are so many issues and you can't figure it out, we finally just went with straight formula, and about half of her reflux stuff stopped. So that's something to consider too. Like isolate it one at a time.
Mhm.
And then I fought really, 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 really hard once she hit a year, because the low tone is a thing too, to get her on some things. And they were really about blended or a different kind of formula. And I was just like, no, this is what I want to try. I researched it to death. So just being able to say, not I know best, but I know my kid best.
That's an
it's
important
hard.
part. That's a very important part. When we were dealing with all the issues with Angel and his gallbladder, nobody knew what was going on. Nobody picked up on it. And they were going, oh, well, kids with neuro injuries. And that's what they like to say for our kids, is that they're, not neurotypical. And they're like, oh, well, kids with neuro injuries, they can get agitated. And I'm like, he's not mad. He's not just pissed. There's something wrong.
Mhm.
You can tell the difference in the way that your kid cries and the way that your kid's reacting. And when
Just
we
because it's
finally,
not typical, it's your normal.
right.
Yeah, 100%.
Once we figured out what the issue was and we took care of it, Angel's off of Catapress, he's off of Ativan, he's off of Valium, and he's fixing to be off of the gabapentin. I mean, and all of it was just in relation to his gallbladder.
Wow.
Yeah.
Wow. Thank you. The mama gut, the mama
Thanks for
instinct.
sharing that.
So
That's
important.
awesome.
I did a step that I have a new pediatrician, and I love her. She's fine. Our old one moved to Knoxville Children's, and we're all very, very, very sad. But she was the one who basically told people to take a hike in terms of weight gain and everything else. And she wasn't like, oh, it's the trisomy curve, it's the olive curve. So that's the other thing too. If you don't fit with a pediatrician or something like that, not just your hospital, not just the NICU, not dealing with, the heart issues and not being treated well because of T18, but if you don't fit that way, that's the other thing you can change. Because if she hadn't fought with me, I wouldn't have felt as emboldened. And I now make nutrition decisions. And I was like, I'm 40 years old. Why do I care? So I took Olive off of overnight feeds about 2 months ago. And no, before quarantine. We had a tornado in Nashville, and then we went on spring break, and then we went to quarantine. So I stopped her overnight feeds the week of the tornado. And we added a feed and added a couple of milliliters to her stuff to get her calories in. And she has not thrown up for the first time in her entire life for a 3-month stretch.
Okay, so Verity may be dropping those overnight feedings.
And I just decided to just try it a few nights at a time. I was like, if she's big enough now. And that's the other thing. People, our experience, what we're looking at now at 3 years old, like you and I, and how old is
It's
Diana
different.
now? It is different.
Ayana's 20. It's totally different than that first year. First year is like
the first year
weight
is
gain and
just like,
stabilizing.
yes, that's exactly
so
it.
different.
Let's get to an even keel for a second.
Mm-hmm.
But that's the good thing about the NG and the OG and all that stuff, because those are temporary. They can cause some issues. Like she has some major dysphagia for having the tube down her throat forever, because that's on me. I fought the G-tube stuff for a very long time. But just the not throwing up, we've gone through so many things. I finally got a medication that she can take if she does throw up, and that helps a lot. So Beverly, you and I need to talk about some of the steps that we took recently.
It's so heartwarming to hear Valerie's story about going from GJ to G.
To come back.
That's I just hope someday that we can do that with Ayana, because I would love for her to not have to be connected 24/7 and the continuous
on the
feeds at
cusp.
night. It's a constant peeing issue, you know, it's just all the little things that go with it. And it would also just mean that her gut is healed in whatever way it's been causing problems before, but we'll see. It was good to hear that story.
We were on the cusp of a GJ because of all of her reflux stuff. So it was Nissen or GJ. And we finally got a GI that would listen to us. And she actually decided she had cyclical vomiting. And she's the only person who even looked at that, because they were like, oh, that doesn't happen in younger kids. And she was like, no, this is so she's the one who gave us meds to have on hand instead of all the time. And that made her vomiting go down enough to feel like we could handle not going for a GJ. So it didn't fix all of it, but it was one thing at a time. It was identifying one small problem that's causing a cascade of everything else.
Okay.
Does she sit up now, Tiffany?
We're working on it. She cannot sit unassisted, but she definitely has better trunk control. But she also, totally unrelated to tube feeding, but she's also a hepatoblastoma survivor. So she had a liver resection, and that cuts across your abdomen. So her core muscles are not great. But once we were able to really focus on PT finally, like out of the hospital,
it's a huge difference.
All of a sudden she started, vomiting less, sleeping better, like just everything started shifting once we got a little more sitting upright time.
It's not quite a liver resection, but Olive has a vesicostomy, so her tolerating anything on the front, she was fine with the G-tube, but the bladder being tacked up was a relearn.
Yeah.
I have a question for Tiffany, if you don't mind, really quick.
Yeah,
Tiffany, you said that Ayana had a lot of problems with gas, and you guys were trying different, methods of feeding her. Did you find in any way that the amount of gas buildup that she had impacted the amount of feed she could tolerate?
So I kind of saw them as separate things. She had gas issues. So I talk about isolating variables. So I would think about gas. What causes gas? Is it an intolerance to what they're eating? Is there an anatomical issue? Is it they're on their back too much? All those different things. So I started doing little things to try to help with that, like sitting her up in a tumble form for a certain period, making sure that we tried gas drops. We did that. But then looking at her diet, that's when we started to figure out the cow milk protein thing. So then I had to change my diet, completely dairy-free, almost vegan. And that dramatically cut down the gas. So she clearly had an intolerance to the dairy products that was creating that. And then the other part of that was, sorry, say the second part of your question again.
No, I was just wondering if it impacted the amount of food that you could give her that she tolerated.
And at that time, she was so small. She was born 4 pounds. So a 4-pound baby, I mean, their tummy is tiny. And I know typically overall, like our Trisomy kids' stomachs are even smaller than the typical 4-pound baby. So that was that's always been a hindrance for us in terms of what volume she can take. Like still, even now, she's only at 46 mils per hour. When we tried to do larger bolus feeds, her stomach can't handle it. She has huge residuals. She will vomit it back up. Her stomach just can't handle large amounts. And obviously when you feed the intestine, you can't do that anyways. So yes and no to your question. But for her, I really saw them as two separate things, that possibly there's other things contributing that are causing the two of them together. Like they may not be interdependent on each other.
Sure. And with Brianna, she's only 9 months old. She is getting 21 mLs an hour. So kind of like you're saying, it's continuous. She gets it continuously through her G-tube.
I've had to be really, really vigilant about that, because I've had some GIs that were like, let's just do 50. Let's jump from 40 to
Yeah.
50. And I'm
they
like,
want to jump so
no.
fast. Our kids
I
Yeah.
go
can't handle
1
that.
mil. I go
Mhm.
1 mil and I'll
Yes.
wait for like 3 days. Like I'm
Yes.
so slow,
Yeah.
but it's what her body needs. And then I can watch and see what happens and
Oh,
know
and
if
then
she's
they're not
handling
always
it.
and then they're not always happy with the weight gain, and so then their
Yeah.
response is, let's do more volume, or let's like Brianna, they've tried to fortify her and it just ends up coming right back out again because
Yeah.
she can't tolerate it that
Yeah.
fast.
Ayana
But,
just did not tolerate the fortifiers. A
Okay.
lot of them are actually dairy based too, so that was a part
Yep.
of the problem. And then like one GI tried to use lactulose once when she had a constipation issue. Lactulose is lactose based. It's dairy. It's
Yeah.
just like there's so many little things. If they're having gas, I would suspect that there's some sort of dairy intolerance. That always helps kind of cutting that stuff out, and then you can kind of peel that back even more to start to see what else could
Yeah.
be.
We
possibly
switched to a
causing it.
dairy-free formula, and that
Yeah.
See,
until she turned a year.
we switched to a dairy-free formula with Brianna, and not because they thought that there was a lactose intolerance, but because they were trying to address the gas. Recently, when we were up at Children's for her heart surgery, she was having like significant volumes of gas. They would actually draw it back with a syringe, and as small as she is, she's just 4 kilos. As small as she is, we would get 40 mLs of air out. I mean, like big volumes of air.
Wow.
And my concern
That's
was
a
like,
lot.
okay, so her stomach's holding a lot, but most of it's air. And
Is she G-tube? How NG?
she's
G-tube?
she's too small for. She never had anything through her nose because she had a TEF, and they didn't want to. They went right to a G-tube when they did the TEF repair. She got a gastrostomy at the same time.
So I would highly consider the jejunal feedings because we tried everything, and it wasn't until either NJ or GJ, it wasn't until we switched over to that finally the gas really stopped.
Okay.
She was
Is
just
she-
so bad.
Is she trached?
Yes.
No,
Mine
You're-
is.
my daughter's not. I'm not sure.
If she's trached, does she have a cuffed trach or non-cuffed?
Brianna has a cuffed trach. Yeah, she just got that 2 months ago. She has a cuffed trach.
Because that would almost make me think too, with her being trached, that maybe the cuff is not inflated enough, and she's
I was
getting.
just gonna say maybe air's getting.
Yeah. Well, and she used to be on high flow. We came home on high flow for several weeks, and we chalked up her high amounts of gas in her stomach to just constant blowing in her nose. But then when she got trached and it's cuffed, it didn't make sense that she's getting so much in there. So we're just kind of guessing at this point because we have tried eliminating cow's milk and that didn't fix it. And then also we have kind of a feral bag system thing set up, but she just gets so much all we're guessing is like she must be swallowing it. I don't know if anybody's had problems with their kids like getting high volumes of air in there and how like what the anatomy of that is. At the hospital, nobody could figure it out. And the nurses, even the GI, they were like, we don't know how that's getting in there.
So Ayana, here, baby, can you turn that off for me? Ayana had very high levels. Sorry, her feeding pump's going. I just want to show you. I just want to show you what we vent into, just so you can understand.
I was going to say a side note, too. They didn't show me how to vent.
Exactly. I was going to say,
okay,
we learned how to vent.
This is actually
ourselves. I learned
from
from Tribe how to vent.
This is from a post-op. She had a post-op surgery, and it was one of her drainage things. And I said, well, why aren't we using this to drain her stomach then? Because she literally had so much gas and excess bile, because when you feed to the jejunal, it actually triggers an overproduction of bile in the system. And so at some point, if you do feed that way, or if you just have an overactive stomach like she did, she would fill 2 of these every day of just chock full. And then this color will change depending on what's going on in terms of, clear to dark green or, other stuff. But this at least allows her to continuously, right here, the air just escapes constantly. And sometimes you can hear it like popping.
We didn't have a good experience with the feral bags. They really didn't do much for Angel. What did the most for him for real was advancing to a GJ. And, you can remember too, that it can always be pulled back to a G. It's not something that is crazy to have done. And I mean, like for real, for us, we can go in, they'll place it, and we'll be right back out in less than an hour.
The same with the
I know-
NJ. The NJ, if anyone's considering it, it's so easy to just pull it out if it's not something that's going to work for you. It's not a life-changing decision. Back up, baby.
That's really good to know. Thank you. Those are certainly some of the discussions that we've had, but weren't sure like how. I'm sure all of us trisomy parents gets to the point where we're like, when do we stop? Like, how many more procedures, and can we make do with where we're at? Can we find a spot where they're happy? Like, and certainly, kind of like you're saying, you get questions about, well, like what could some of the negative consequences be? Like, what are we looking at with that too? So I really appreciate the feedback on that.
Remember too that while they're smaller, you're still learning your child. Like even with Angel, we have things that come up. Angel's 3.5, he'll be 4 in November. And we have things that come up and we just have to tackle them as they come, because like first we had to deal with the respiratory issues. Then it was the feeding issues. And then it was, you know, a number of different things that come up. So just remember to kind of take everything as it comes and just make the best decision that you can.
Very wise. Very wise. I did have a question that had been submitted before our talk, and it's regarding the GJ. What are, and I'm thinking just from listening to you moms share, I think I know the answer, but she asks, what are the risks in giving mini breaks? And then she clarifies 10 minutes or less in continuous feedings.
0 risk.
That's not really an issue.
Okay.
At all.
Just flush.
Just flush.
I mean, it could even sit there for 10 minutes, but I would still flush just to be safe with water.
Okay. So that was the only official question that came in. And then I appreciate you parents jumping in with questions. Are there other things that you want to chat about before we wrap up for the night?
I definitely had a question. Sorry I didn't get to submit it earlier, but
Okay,
what was that?
I said, no problem, just go for it.
Okay. Yeah, so for those that may not know, Caleb is about 5.5 months old, and he has tetralogy FLO, or a double outlet right ventricle with pretty severe pulmonary stenosis heart defect. And then he was born with gastroschisis, so we kind of have the added concern of feeding and everything. He's been fed since basically day one with NG tube, and that's what we brought him home on, and that's what we've been continuing to do so far. And one heart surgeon that we've talked to that has so far declined to do surgery had basically said that he wanted him to get a G-tube before heart surgery. And then I've had other people say, well, the heart surgery should really come before the G-tube. And so I just wondered if any of you all have had experience with getting, you know, some sort of a G-tube or something like that in addition to a heart repair, and if so, what order it was done in and what that experience was like.
Yeah, we had it's like a prioritization kind of. We had that scenario because my daughter needed heart repair, the congenital diaphragmatic hernia repair, she needed a G-tube, and then we found cancer, so she needed a resection plus chemo. So we were trying to decide what order, and everybody emphatically said heart surgery before everything. They were able to bundle the diaphragmatic hernia with the heart repair to make that easier, but they said they would not do a G-tube with that because there's risk for infection when you get in mixed separate parts of the body. So she did that stuff first, healed, and then a few weeks later she had the liver resection plus G-tube together.
Angel
We're
had
actually,
heart surgery.
Go ahead.
Angel had heart surgery after he was a year old, but he had his G-tube placed well before that. They looked at doing his heart surgery when he was like 3 or 4 months old, but they denied his heart surgery just based on the trisomy 13 period. He was denied his heart surgery more than once, and we went ahead with the other interventions as a way to help get him to the point to where he could get the heart surgery. So in that case, it may be a situation where he may do better if he gets the G tube and be able to be. I'm on the phone. Yes.
Yeah.
Where he may.
Yeah,
Sorry.
it's kind of interesting hearing some of y'all talk about feeding, because even with the gastroschisis, like we've had, so far, and knock on wood here, but we haven't had any problems with spit ups or, really anything. The biggest concern is occasionally, him getting backed up a little bit, but we do right now, we do continuous feeds 14 hours a day at 50 ml an hour. And then we do a couple of bolus, like 50 ml boluses in the off hours. And so far it's going great. And we're, kind of gradually increasing the continuous feeding rate while dropping the time period that he's on continuous feeds to move towards bolus.
I think a big deciding factor in when you do what, especially in your situation, I feel like would be just the anesthesia element and the sensitivity that so many of our kids have to that, and whether you feel like having general anesthesia to go get a G tube, would they be okay with that, or does the heart situation need to be tackled first? Like, it's for us, that was kind of how we made the decision.
Yeah. I've heard that about anesthesia before, and I haven't really, he's been under general anesthesia, I think 4 times now, and we've never noticed any issues or anything. I mean, what kinds of things do some people experience with that?
Ayana just couldn't get off of oxygen. So even if she had to go in just for a sedated MRI where you're just supposed to be outpatient, she'd end up inpatient for 2 days on, a little tiny bit of oxygen, but she wouldn't be able to maintain her saturations without it. It would take a little while.
Olive is unrepaired at this time, and it takes a little bit to come out. It definitely does. We now have a anesthesiologist that is ours, but it took a while for them to figure out what she could handle when.
And some kiddos are going to react differently to different ones. I know Verity stopped breathing when they gave her fentanyl, and so that
Same.
Oh, yeah,
Now,
Caleb does the same thing.
Yeah. Now on the, not ever in a million years.
Big red letters.
Yep.
And see,
I think
April
they
does fine.
I think they put down on Caleb's chart now that he's allergic to fentanyl.
Yep.
Or something like that.
Yep.
They got to have something
'cause-
in there for the checklist.
Yeah.
And
Yeah.
see, Angel does fine with all of that. A lot of the parents warn against morphine and fentanyl and those type of things. And Angel, he does fine with them. He has no issue with them. He does good with the sedation. The only medications that we've really had issues with are antibiotics. He's actually allergic to 3 of them.
Oh, wow.
Yeah, I guess the anesthesia was mentioned a while ago. I guess we've never faced any issue with that because Caleb's always been on oxygen and he's trached. And so it's probably not noticeable like it would be otherwise.
Okay, folks, any other questions related to feeding tubes? Or, and this isn't specifically an oral feeding session. We are looking down the road at talking specifically about oral feeds and feeding therapy and that kind of thing. But we have a couple moms with some experience helping their kiddos get, working towards that. So if you have questions about that too, go ahead and ask away.
I think a couple of moms have talked about their kids having oral aversions just with different, feeding methods that you've tried over the years. And then just that's kind of where we're at right now with Brianna. Even putting her hand to her mouth, sometimes she'll just start gagging because she's touching her mouth. And I think I've gathered that was kind of addressed, or is in the process of being addressed through, is it speech therapy, or what are some of the things you guys have done to overcome oral aversions?
For us, speech therapy is with our feeding therapy. It started because she stopped taking her bottles, and then we just kept it, and now we're 3 years in. She has a feeding therapist that comes to the house once a week. It's through our hospital, so it's not early intervention. She works directly with the entire hospital system with us, and we really just, it's a constant offer, and sometimes she's okay with it and sometimes she's not. She does actually tolerate her hands in her mouth now, especially since she got her teeth. It took a while. But she will tolerate about 10 to 15 bites. And there are certain things she will take and there are certain things she will not.
Yeah, Ayana had some pretty bad oral aversions. I believe it was from intubation and just, we were in the hospital for 8 months, so it was a long time. So she actually had her whole one side of her face would break out in a rash every time she tried to do speech therapy or if you touched her face. So it's honestly just been like patience and desensitization. Sorry, I can't speak right now. And trying to just, Z-vibes, toys, me touching her face when we're just laying here, kissing her. I tried to find, really gentle ways to try and nurture that a little bit. I haven't really forced too much in terms of like oral feeding. When I do give her a little drop of water or like a little taste of applesauce that her sister's eating, she has a really hard time. So
does she gag, Tiffany, or does she just not like it? She gags?
She has gagged before. She also is just kind of like, what the heck are you doing, lady?
See, Olive is at a point where she doesn't gag. She can do the puree. She cannot. We've had aspiration every single swallow study. And with everything
she
else,
passed her
it's
swallow
just,
study.
It's
so
just
that
not,
wasn't the issue.
For me, it was a prioritization, like you said, for other things. Yeah. It's just not worth the argument with her, I guess. So we keep up the puree part. Well, basically, I'm going to find out tomorrow where we go with this. She tolerates a high level of vibration. The Z-Vibe is almost sometimes not enough. She doesn't want a spoon, but if you give her like the jiggler, or there's a couple other tools like that are like, my hand will go numb holding it. She tolerates it. And I think that it actually isn't her mouth reaction. It's actually her nose issues, which Olive isn't a typical T18 or 13. She had no holes at the top of her nose when she was born. There was just bone. So all of her breathing issues were through that. All of the, I think that she probably has no sense of taste, or not very strong sense of taste. So we think a lot of it is related to that. Since they drilled through that so many times, I think things are really desensitized there. So the constant just offering the reminder, it's really just an over and over. I don't know if that answers the question.
I would just say speech therapy, but you can also just do stuff on your own. Like you can see her cheek. It's just touching, like just gently touching her face when you're laying together and touching the mouth area, especially if they're averted somewhere. You can even just put your finger and just kind of leave it there. Nothing hard.
Especially if
it's just pressure.
They're probably desensitized. You've had kids that have tape on their face all the time.
Mm-hmm. Yeah.
Okay, final call. Any other questions? Thank you so much to our panelists, Pam, Tiffany, Amelia, Valerie. We so appreciate you sharing your stories and experiences. And thank you to all of you that joined us live. And if you're watching this later, we hope it's been helpful for you. We will be announcing our upcoming topics and looking at doing this about once a month. And yeah, so if you want to stay and chat for a few more minutes, I'm going to have to get Verity started on her feeding. But Amelia, I'll be pinging you and you and I will be chatting more later.